I always wanted to be a nurse from day one. My mother was a nurse, so was my grandmother. I wanted to follow in their footsteps, but I left after my first year because of such a negative experience that I had. A lack of financial support was a real reason. It was only £180 a month, which didn't cover the costs of getting to placement and living costs. It was £60 a week to park there, so nothing added up. Between the commitments of studying, being on placement, there was no time to fit in any paid works. The nurses on the ward were clearly overstretched themselves. There was a lack of permanent staff. There just wasn't enough nurses. The financial issues are certainly common to other students, and it seems to be the biggest issue to why nurses don't continue on their course and don't make it to registered nurse status. Nobody's asking to be paid, the same as a qualified nurse, but just some sort of wage that means people can afford to live. And make sure that students are supported on placements. If a student's going to the university and saying things aren't okay here, they need to be listened to and taken seriously and not just brushed under the carpet. I'm hoping to go back to university next year to begin nursing a master's, and I'm currently working as a HCA on a trauma ward. I think it's a privilege to look after people when they're in the worst moments of their lives.